Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this episode, I'm going to talk to you about what my favorite medication is. So since starting this channel, we've talked about several different types of medications. I think we're up to about 270 videos covering different meds. But in this video, like I said, I'm going to talk about what my favorite personal medication is that I use. Several of you may have seen the video I posted before about what is bipolar disorder, so this medication has to do with that illness because I do personally have bipolar disorder. So I'll start by getting right to the point, and my favorite medication is Loxapine. This is a medication that I don't use consistently, but I do use quite often in the springtime, as well as when I do suffer from mania. The first time I used this medication was during my 4th manic episode, and I used it in hospital, and after about 3 days, I came down from severe psychosis where I was experiencing the Truman Syndrome, where I thought everybody on earth was an actor, as well as thoughts of thinking that I was God. So again, after using this medication for just 3 days, I came down from that psychosis and felt back to normal. Now, throughout the year, I mentioned that I don't use the medication consistently. However, if I go 1 or 2 nights without experiencing a full night's sleep, I will use this medication to make sure that I get a full 8 hours for a couple days in a row, usually 3 to 5 days. The reason I do this is because with bipolar disorder, my psychiatrist told me, and I've learned in school, that the first thing to go is usually sleep. So if you can maintain a regular sleep schedule, you can avoid having manic episodes. Aside from treating mania and helping me sleep, this medication also indirectly helps me with anxiety, because if I know I have this medication to be used when needed, it actually helps with my anxiety because I know that I can treat myself appropriately and try to avoid having a manic episode. After having 5 manic episodes in 5 years, it does create a lot of anxiety because you're always scared about having that next episode. Sometimes you wake up in the morning with anxiety just thinking, oh my God, is today the day where I start to go manic again? These Loxapine tablets that I have are 10 milligram tablets, and the instructions for me are to use 2 tablets as needed at bedtime. While I was in the hospital with psychosis during mania, I was using 3 tablets at bedtime. Another reason that this medication is my favorite medication, aside from the fact that it does help me treat mania, is that I've tolerated it very well. I haven't had any side effects whatsoever with this medication. Now, I do use another antipsychotic daily called Zeldox or ziprasidone. I use 40 milligrams of that medication twice daily. However, that's not my favorite because that one doesn't really bring me back down from mania, and it doesn't really give me the security that Loxapine does because I had manic episodes while using Zeldox as directed. So I personally think it's important with all patients that have bipolar disorder to have an antipsychotic that they use daily, but to also have something similar to Loxapine that they can use when they feel off, especially during the springtime, as that time of year seems to be prevalent for mania. This is a medication that I plan on using indefinitely throughout the course of my life, and I will use it probably consistently during the spring, like I mentioned. There was actually one time recently, about 2 weeks ago, where I had to use this medication for 3 nights because I was coming to the end of the 3-month period where I typically use Wellbutrin, which is an antidepressant. Starting in about October, moving into the winter months, I do experience depression, so I use Wellbutrin to help stage off that depression. Now, this medication has a 3% chance of bringing on mania in bipolar patients. So near the end, coming into March, I actually did kind of start to feel my thoughts race a little bit. So I immediately stopped that medication and started taking Loxapine for 3 nights. I could immediately feel my brain reset itself and really feel normal, and my thoughts stopped racing. I am really thankful that I found this medication. Unfortunately, I started using this medication during a severe manic episode. So it wasn't the best way to be introduced to it, but at least because I started it during a manic episode, I know that it really does work for me in the most extreme circumstances, so in that psychosis phase. And it was actually me who asked the psychiatrist in the hospital if I could have a prescription of this medication to bring outside of the hospital and use on an as-needed basis, and he thought it was a great idea. That's all I really have to say in this video. I just wanted to quickly share with you what my favorite medication is, and it is Loxapine. I will put a link in the description to my What is Bipolar video, which kind of goes into my personal experience with bipolar disorder. So if you're interested in hearing more about my personal experience with that disorder, just check for the link in the description. All right, that's all we're going to talk about today with my favorite medication, Loxapine. As always, if you want to help grow this channel, you can like the videos, share the videos, or subscribe to the YouTube channel. And if you have a favorite medication yourself, don't be scared to comment below in the comment section, and we can have a discussion about medication. All right, everybody, that's it for today. Take care.